biometric, so it's reading the blood vessels in your hand.
With the scan of a palm, medications dispensed. This machine, part of Main Street Project's efforts to protect people from dangerous street drugs. Brianna Sukram's the harm reduction nurse for their Safe Supply program.
So during our intake process, we actually ask everyone, do they have fear of encountering a toxic supply or encountering a substance that could be fatal? And every person says yes.
The program provides a select group of people primarily addicted to opioids a prescribed daily amount of the opioid hydromorphone. Dr. Shelley Turner is the medical director. She says participants go through an intake process, then get a prescription to meet their needs.
What we're trying to do is to give them enough that they need to function day to day so that they're not going to have withdrawal. Do some people need it to get the effects that they want? For sure. And what some people are dealing with, chronic pain, chronic non-cancer pain, and significant health issues. And so not only now you're going to deal with withdrawal, but now you've got to deal with pain on top of that. So the complexity is there, and that's why we see them every day.
Manitoba's Office of the Chief Medical Examiner says of the 292 drug-related deaths in the first 9 months of last year, 159 involved opioids. Turner says this program aims to prevent deaths and is blunt about why she believes in the work they're doing here.
You can't treat dead people. You have to give people a chance. And if we turn people away, people are going to die. The supply is toxic.
The community-supported opioid access program, as Main Street Project calls it, has been operating for more than a year and a half. The team says there's 5 participants, the maximum they've had at once. There's been 8 in total. People are also connected with wraparound supports like mental health or primary care. Main Street Project's Director of Community Initiatives, Karen Murison, says they're meeting people where they're at and helping them achieve stability.
When folks are sort of spending a lot of time chasing or trying to find that supply that is also toxic, it causes a lot of different things in their lives that can have negative effects.
She says she's seen the benefits the program's had on people.
We've seen someone reconnect with family and be with their children much more often. We've had a couple people return to work that haven't been working for a really long time. We've had folks that have been housed.
If a participant wants to stop using substances, she says they'd support those efforts. Brianna Sukram, the nurse with the program, calls it a game changer for people.
I think the big thing is it connects people back to their family and their loved ones, and they can work on themselves.
Turner says they only prescribe hydromorphone. In the future, she wants the program to expand to other drugs like fentanyl.
Really what we're trying to do is to prevent Manitobans from dying. I don't want any more Manitobans to die. I don't want any more Canadians to die. I lost my cousin in 2022 to an overdose. I think if every Manitoban put their hand up of who they've lost, it would be shocking.
Main Street Project says funding for the program initially came from a federal grant through a British Columbia program. Foundation funding and private donor support now cover costs, including medication not funded through health benefits. Alana Cole, CBC News, Winnipeg.